welcome to Hatching for Health, the Jessica Hatch Show. Tonight's guests are going to be calling in from Texas Children's Hospital, and they are actually visiting from Ecuador in relation to their child's care. So this is a very special episode because we are trying to bring awareness to her condition, as well as help them raise the funds to complete the procedures that she is needing. She had a cerebral stroke. So we're going to go ahead and welcome Lauren and Roberta, the daughter, to the show. How are you guys?
Hi, how are you? Thank you for having us here.
Definitely, yes. So you guys are in Texas Children's Hospital right now, is that right?
Absolutely. Okay. That's why I was telling you we have the amazing lighting and scenery. We're in our room right now.
Yeah, I don't have a lot of choices there. So Roberta, how old are you?
9.
You're how old?
She's 9.
9? Okay, 9. So you guys are not here by choice, obviously. This was an emergency situation that brought you guys to this very moment. And you're here with your husband, Emilio, as well. Tell me how you guys came here and exactly what happened.
Oh, right now we can say it's a long story, but when it started, it was a couple of seconds that changed my life. We were playing at home. We tell this to everybody because when you say raising awareness, it's amazing how this happens. It's so fast. You have no notice whatsoever. We were playing in the house. What were you doing to your dad? She was kicking her dad. We were just playing around.
Yeah.
And he came to talk to me about something, and Roberta suddenly just fell to the floor and said, I got hit in the head. And my husband was far away, so we were looking at each other and just wondering what happened. And we were telling her, no, nothing happened, everything's okay. And she held her head and collapsed. She managed somehow to get up and walk to me, and she held me, and in my arms she collapsed completely. All of her left side lost mobility, and her face started getting like crooked. We didn't know what was happening. We thought probably she hit her head with something, and it took us, I relive this moment in my head 1,000 times a day.
Yeah.
It was probably 15 seconds at most, since she said my head hurts until she collapsed, and everything changed. So we went to the hospital. We didn't call an ambulance. We were close enough to the hospital to just speed there in our car. We're trying to keep her alert. We thought it was a concussion. So keep her awake, just ask her stuff, make her talk, and she couldn't even talk.
Roberta, does Roberta remember any of this? Yeah. Like the moment whenever it happened and you kind of trying to tell your parents something happened? You do?
I just remember that my head hurt a lot. The right side.
Okay. So they're rushing you to
the car?
Don't sleep.
Don't sleep. Keep awake. Stay awake.
Mm-hmm.
All because we thought it was a concussion. That's what we were going to the hospital with. And what you hear everywhere is keep them awake. Don't let them fall asleep.
Mm-hmm.
But it was a weird concussion because of all of her side being weak. So we got to the hospital, and the doctor examined her in the ER and told us it was, what was it? No, first, do you remember what they said? You had epilepsy. So that was the first diagnosis.
Really?
We have some issues with that diagnosis and how it was made, and the time it took for them to decide on having an MRI done, because that's something I pushed for, and they didn't do it when we got to the hospital. So she lay down in the ICU for hours, screaming in pain, and the doctor that was her doctor at that moment just gave her something for her seizures that he thought were seizures, and nothing for the pain. So my daughter lay screaming for 15 hours in the ICU.
Oh my gosh.
And
And she's
it-
never had
it was
any history of seizures or epilepsy. So this is just something that they, came out of nowhere with, without even having an MRI or anything else. It was just a diagnosis made. Okay.
out of thin air.
And so, Roberta, you were actually in a tremendous amount of pain. And again, for you as a little girl, you didn't hit your head, you didn't fall, like, you fell after the feeling of what felt like your head was hit. But that must have been so difficult, 15 hours, just no one giving you an answer, and the pain. How were you feeling in that moment?
Very bad.
Do you remember it?
I just remember dark.
She remembers dark, she says. The ICU was very dark, and yeah, it was traumatic because we didn't know what was happening, and all her brain at that moment was just not receiving any blood whatsoever. I don't know if you've seen the images, but it's the whole hemisphere.
From some of the posts on the GoFundMe page, I mean, it's got it circled, and it's, completely something that would scare anyone by looking at it. So 15 hours. So what are they telling you? I mean, how did you get from there to here? Like, and what changed?
Well, there's a parallel story that hasn't been told that much, but I'm still being diagnosed. I don't fit the whole diagnosis, but I have multiple sclerosis. So that happened a couple of years ago. And when I got my diagnosis, the only thing that gave us clarity was an MRI, 36 hours after my symptoms. So when I got to the hospital, because of my experience, I was telling the doctors, if we're not losing a window of opportunity, not doing the MRI. And I pushed for it so much. And the next morning, I was just screaming in the ICU that they had to have an MRI done, that what they had done was nothing, and we were not seeing what was happening inside her brain. So I just made a fuss and just fought with everyone there, and asked for a change of team, for a change of doctors, and everything just was really hard because of the politics in the hospitals in Ecuador and how they managed themselves. But finally, we got a team, and somehow these things that happen in life that you cannot explain, but the doctor that we got for Roberta, she worked here at Texas Children's Hospital, and
wow,
from then on she controlled her pain. They gave us the diagnosis of a stroke. We saw the images, and since that moment, 15 hours after the epilepsy diagnosis, we've been in the best hands you could imagine in the world. So we're lucky in ways we cannot imagine and describe.
Such a blessing. So this doctor was visiting and doing, I guess, kind of on-call work in the emergency room, and they're in Ecuador. Is that just kind of happened?
Yeah. Well, she was referred to me by my neurologist.
Okay.
And we just called her Caridad Dávalos. She worked here in Texas Children's for a long time. And when she got to see Roberta, she was just, as I tell you, she was screaming in pain. Nobody could control that. Just crying and screaming and just falling asleep from pain and waking up screaming. I was asking everybody to give her something for the pain, and they were giving her things for seizures. I have no idea what happened there. We're trying to understand as well. But when Caridad got there, the first thing she did was control the pain and get the MRI as fast as possible. And she works, it's something that doesn't happen in Ecuador, but she works with a team of doctors. It's not only her.
Yeah.
And we got a pediatric neurologist, ICU doctor, that's her. So finally we had these multiple perspectives, a rheumatologist, a lot of people just looking into her case. trying to figure out what happened and why it happened.
Of course. So the pain, I mean, because, from my understanding, when people have strokes, it causes situations like you're saying where like one side of the face droops or even entire body all the way down. But I've never heard it. So is the pain, is that for that specific type of, like you're saying, cerebral stroke, like that particular one causes an extreme amount of pain, or is that just because she's a child?
Well, strokes can cause pain. It's known to do so, but they're much more common in adults, especially older people. It's when you're talking about a pediatric stroke, it's not common at all.
Mm-hmm.
She had a huge stroke that came from the thinning of her artery. There are 3 main arteries. It's something I learned in this process. You have 3 main arteries in your brain. One of hers collapsed completely, and you can see it as well in the images. It disappeared. It completely disappeared from one side of her brain, and that made her brain lack oxygen. And what happens is, like, when you hit really hard and you get a bruise, that happens in the brain at that extension. So what starts happening is your brain starts filling with water. That's an edema, and it swells. So the swelling of the brain against your bones, against your skull, makes it hurt so much, because it's just growing bigger and bigger, and it's encapsulated in your skull.
I can completely, now it makes sense. I mean, just the pressure alone of that fluid kind of filling up, and there's not space for that. So it just, continues to push and push. We do have to take a quick commercial break, but we're going to come right back to this moment of the story when we get back from the commercial break. So we'll be right back with you in just a moment.
Guests in your home should only include the ones you invite. When it's time to unwind and catch up with friends, the last thing you need is more work to do. The BioMist mosquito elimination system will put your mind at ease and entertains those unwanted guests, giving you the undivided quality time, focus, and attention you and your guests deserve. BioMist mosquito elimination system will also rid your home from webs and spiders while eliminating mosquitoes carrying mosquito-borne illnesses such as West Nile, dengue fever, and others.
Welcome back from the break. For those of you that have just joined us, we are talking with a family that's here in Texas Children's Hospital visiting from Ecuador. The little girl was diagnosed with cerebral stroke. Her name is Roberta, and she's here with her mom, Lauren. So guys, we were talking before the break just about, you finally got an MRI and what you feel have been properly diagnosed. And we're talking also about this unique blessing really that came about with the team that's now helping Roberta get more answers. I mean, almost one from every specialty. So what was that situation at that point, now that you know where this pain is coming from? Like, what were the direction that they gave you? What did they say we need to do to, basically help her?
Well, it all changed from there, because from treating a supposed epilepsy to a brain stroke, it's diagonally opposed. So everything changed. She was put on steroids and pain medicine. She was getting morphine directly into her, probably 3-4 times a day, every time she got all of the pain just kicking in. And we were trying to stabilize her, but the ICU we were staying in was not the best environment. We were just a door away from the cold, and steroids, they tend to reduce all your immune system. So we were moved to a room where she kept receiving kind of an ICU monitoring. But the day she got to the room and got out of ICU, we started seeing enormous improvements. Just a change of atmosphere and the lighting being able to see out of a window and see a tree or a bird, it kind of woke up her brain. Well, the part that we lost is completely lost. That is not something she can recover. It's scarring really well, so the edema just got reabsorbed by her body, because there's also a risk when the edema is forming that the pressure is too much and you have to remove a part of the skull so the brain can swell. And that was something we were looking out every single day, just the pressure in the brain, to monitor it and see if anything that big had to be, the decisions had to be taken. But we were lucky as well. And in that time, our doctor told us that there were few hospitals in the world that had an inpatient treatment that could help her rehab. Because in Ecuador, what you would get is a couple of visits a day from rehab specialists at your home, but it wouldn't be a treatment. It wouldn't be a complete system around her helping her get well.
Correct.
So, coincidences in life, or however we want to call them, angels, God, or coincidences, just pure luck. We were looking into our insurance, and that's something I tell everybody in Ecuador. Insurance in Ecuador is not something you do or something you have regularly, but this saved us. Just having an international insurance changed every outcome we could have expected. So we were looking at the insurance, trying to see if we had any coverage whatsoever. Our doctor was recommending Texas Children's Hospital. She knew about this, the attention she would get here. And miraculously, the only children's hospital that was covered by our insurance is Texas Children's Hospital.
Wow.
So
your insurance,
it was,
that's an international insurance that you have out of Ecuador, covers, only certain places around the world, and Texas Children's Hospital, which is where the doctor happens to be, where, with you guys in Ecuador, is actually a treating doctor. So flying from Ecuador to the US commercially was not really an option. So then you're applying through your insurance about getting here through, I guess kind of like a helicopter ambulance type situation. And then this finally happened for you after a fourth attempt for them to approve it?
Yeah, I think it was more than 4 attempts on the back end.
Yeah.
But well, we got it to a point where we were going to pay everything on our side to get her here. And that's why we had the GoFundMe page. But finally what happened was the insurance covered a part of it. Not all of it, but they covered some of the transport over here on an air ambulance. It sounds fancy because you travel in a jet, but it's the most uncomfortable situation for a patient. Yeah, she was on a stretcher, tiny little stretcher for 12 hours.
Really?
From Ecuador to Texas.
Horrible.
She's like, I don't recommend it. I would rather my first jet experience be something different. So that was, so your insurance covered a portion of that, and then another portion of it, I guess as part of all of these medical expenses that are, kind of accumulating and putting you guys in a position where, you can't stop treating her. So you have to figure out, a way to get the additional funds, which I know the GoFundMe page is how I was able to see you guys through my girlfriend, Angie Cueva, or Mary Angeles Cueva from Ecuador. So she was like, oh my gosh, sis, you need to meet this family. They're even here right now. You might be able to talk to them on the show, but she's obviously very encouraging about trying to help reach those additional funds needed. Because I'm shocked even you've been able to get as much covered as you have through the insurance. That's, like you said, very much a blessing. So you arrive here and they immediately, I guess, kind of start intense therapy with her?
Yeah. Well, it started, we got here on Thursday a couple of weeks ago. On Friday, she already had a schedule. So she has, and we've been learning as well, but all the acronyms, OT, PT, speech, she has physical therapy, occupational therapy, language or speech therapy. And part of parallel to that, what we're trying to do, and one of the reasons that we're here is we don't have a final diagnosis on her. We don't know why this happened.
And that's
we
what's
know
going
what
to be
and the extent of it.
the question.
Yeah.
Yeah. It's like, how does somebody potentially avoid this, but you don't know because you can't identify.
No.
So there's the three main.
And that's one.
Yeah, no,
Tell me.
No, the three main blood vessels you mentioned that go to the brain, and you're saying like what caused this particular stroke, I guess. So if any one of those three, it becomes what we call a cerebral stroke. Is that correct in saying?
Yeah, well, you have different ways of getting a stroke. It can be because of the blood vessels. It can be a hemorrhage that you have on your brain. Well, there are many things that can lead to a stroke.
Yeah.
On her case, what we got from Ecuador is called a vasculitis that has to do with the vessels. An inflammation so large that imagine this is your artery, it gets so thick that inside the walls just collapse on itself. So there is no blood flow whatsoever.
Yeah.
And they collapse and they never recover. Sometimes you get a clot, and that's something you hear a lot. There's even a surgery that can be done and remove the clot in the first 24 hours, and the blood flow will go back and you'll regain.
So there was a potential. Okay, so unfortunately, like we're cut short on time. So there could have been, I guess, a surgery, you're saying, had they identified the problem early on, like within the first hour, like a very small time, or window. But since they did, now it's figuring out, well, regardless what caused it. So she's doing the therapy and they're continuing to research or I guess the cause of it. Is this, I guess on the therapy side, like where are the additional financial burdens at? So that just for the viewer's sake, so we can understand on how we're able to help.
Okay, so we've been learning about this as well, but the additional costs are not short-term. We're thinking of outpatient therapy that could be years to a lifetime. She has to get a wheelchair. We just got this lease wheelchair. They can go up to $16,000. It's crazy. She has to get braces for her legs every 6 months. Those each are over $1,000. Only therapy as outpatient, you're looking at an hour rate of $150 to $600. So everything that's coming our way, we're just like deers in front of lights, just trying to understand what is going to happen. If we're going to have to stay longer here in Houston, we're going to be admitted for the time being until mid-June. And then we don't know exactly what's going to happen if we're staying here in Houston, because we don't have the funds to do that. Or if we're going back to Ecuador and just crossing our fingers, somebody can follow therapy over there.
Her care and help and be able to do those things. Because I guess a lot of this treatment she's getting there at Texas Children's is an advanced level. It sounds like where, maybe it wouldn't be everything you could have accommodaed in Ecuador. Is that fair to say?
That's why we're here.
Okay.
Yeah,
so
that's why we're here. They don't even know this concept.
Yeah, so we're going to do our best to put this in front of as many viewers as possible, just to try and help raise additional funds. I mean, that you guys' lives have been flipped upside down. I mean, the financial side, unfortunately, is something we can't pretend not to see. But I mean, you have this precious little girl with you that was normal just a short 6 weeks ago.
We're getting on our 4th week tomorrow.
Okay. Yeah, and so it's an entire life change in mentality. So we're gonna do everything we can to help, and we'd love to get an update from you guys possibly in a week or two to know if they've got any answers, because for others watching, I mean, this is the last thing anybody wants their little boy or girl to go through. So we'd love to continue to get information from you guys, and I hope that we're able to help, whether it's here or from Ecuador. But you guys are beautiful. I'm sorry I'm crying, but
No, thank you. I know it's overwhelming.
Yeah, no, I really hope that we can, make a difference in you guys' lives. So thank you for, most importantly, being willing to come on the show. And I wish you guys the best. God bless you. And thank you all for watching. And we will share the GoFundMe link so that you guys are able to help this family in whatever way you feel you can afford to do so. So thank you, Hatching for Health fans. And thank you, Roberta and Lauren, for being a part of today's episode. We'll be right back here with you next Tuesday at 7:30 p.m.